A warm welcome, dear viewers, to our series, Back to School. It's a very special pleasure for me today to have a specialist here who has also been trained in a very special area. She's an acupuncturist, and she is a really world-famous and has also trained many stars in medicine. But today, I don't want to talk about the medical side, but about the premier class that exists in medicine, in my opinion. Welcome, dear Beate. Thank you for being here.
My pleasure. I'm happy to be here.
Dear Beate, I've read the book.
I can see it. Did you read it underwater?
Yeah, I know that I'm that type of guy.
I have to bring you a new one.
No, I'm sorry. It is true, I usually work with the books in the bathtub.
I see.
And I've rarely read a book as good as this one. Really big compliment. I'm sure you were also totally guided in this book. There are things in here, and I call that the premier class. I believe that is the goal of medicine, that we will eventually try to solve all the problems and situations of life or our body, of relationships, God knows what, at this level. How did you come to this? You're a successful doctor, and suddenly you use partner counselling in this premier class and have success, extremely good success. And those stories in there are incredibly beautiful. How did it come about from one side, from an acupuncture and general practitioner, specialist, suddenly switching to this area?
It's absolutely exciting for me to think about it again and again. I come from orthopaedics. I did orthopaedics for 6 years, 3 years internally. And in that time, I only believed in things that you can touch. Back then you could have chased me with something psychic. I studied in Glasgow. I had to do an internship in psychiatry. And it was so difficult for me, I couldn't do anything with it. But people change too. And I was forced to change. And through an important thing. After I was allowed to do acupuncture in orthopaedics, this ear acupuncture, where you can get the body to react very quickly, and you see quickly someone has a rotten tooth that inflames their big toe or causes rheumatism, migraines, or which scar is causing trouble. Nature took the liberty of making a joke with a human being, namely it had depicted him holographically in several places on the body. And nobody knows why she did that, as if God had been sitting up there thinking, how will we do that? Maybe on the ears, on the hands, on the feet. With the woman in the vagina, in the mouth, we're depicted holographically as an image everywhere. And where you know your way around particularly well, that's where you work. I knew exactly that it was mainly also pain therapy. I can tell you by your ear where you're blocked, whether you are depressed, for example. I work for the world's largest medical association in acupuncture, that is the German Academy for Acupuncture in Munich. I'm a training manager, so I am a teacher, I come from a family of teachers, and that will play an important role in explaining how I even got there. When I finished orthopaedics, my first husband went into neurology and I went with him. And I knew now was the time to open a practice, but I was in a dilemma. Wait a minute, this method takes me a lot of time. The first session's always an hour, the follow-up session's half an hour. I can't do that in a public practice. That was 30 years ago. 30 years ago, I opened a private practice. I was young, naive, and brave. I just knew I could do it. I was allowed to do it in the clinic. The boss said to me at the time, you want to do this for me? Fine. If you can find where it's blocked on the ear, and I can understand that with the hands on 3 patients, you can do it. And so it was. That's why I was allowed to do that there. For 6 years, when you practice for 6 years in orthopaedics, that's the playing field for this method. You have back pain, well, I'll see where it really is. Is it this vortex or is something hurting you there? I'll see if your sacrum and iliac joint is out of place or visible on the ear. I knew how to do a private practice. Nobody did private practices back then, and that wasn't the idea behind it either. I now earn a lot of money with it. I looked into old plans. At the time, I had 12 patients a day, one day. Today, 10, because today the spectrum has expanded even further. And you get paid to help. Great at the beginning, but I kept training people. There were years when I saw 1,000 newcomer doctors. They all do good ear acupuncture. What happens to the instructor? They get to the top of the pyramid. They get the difficult cases. And at some point I noticed, hang on, when someone has a conflict, It's like having a bucket of water where your energy is in. I fill up the water by putting the needles and giving herbs and doing all that. And at the bottom, it has 2 big holes and it drains faster than you can refill. Conflicts are, do I go or do I stay? It's like jumping back and forth or sitting between 2 chairs. It takes so much energy. That kind of threatened me. I had to take care of it. At the same time, thank you very much, there were personal experiences that also went in the same direction. Annoyances in the relationship that could not be explained that way. At some point, you will do it your first seminar, and one patient ultimately said to me, a psychologist was lying on the couch and said, "I saw through you. First you ask difficult questions about what's going on, and then you leave me alone with the needles in my ears." And then she laughed. My answer to that is, I paid a lot of money to be able to ask these questions, to understand what it's really about. And one day I realised it's because I am a teacher. Good teachers make a system to explain difficult things easily. Einstein said if you can't explain it in simple words, you don't get it. And there was the moment when I thought, hang on, those are rules that apply to everyone, really to everyone. If someone says to me today, well, I'm divorced, I ask, and why? Well, it didn't fit anymore. Interesting, tell me more. I don't want to know what happened to them, but what bothered them the most. Did something annoy you? Didn't you get along with something? Great. Let's put it here on the table and then let's see what it has to do with you. I'll give you an example. One patient says, my husband always has back problems, always back problems. Yes, my husband. I said, is there anything in your life that you could change? That's the question of where you're going. There is such a magic question that I like to use, to kind of sneak in. In my practice, I always have 2 important things in my pocket. One is this magic question, and the other is a little bit of soft soap. I then lay out the soft soap so that patients slip onto the path where I want them to go. That's how I make money. I have to make people pain-free. But at some point it grabbed me too, so I was interested. The magic question is, if money, time and space would not matter, I'm the fairy godmother. I come to your bed and say, Alexander, I'm only here now. Here is my basket. Money, time, space and possibilities do not play a role right now. What would you like to change? And you only have 1 sentence to tell me. So if your job doesn't really suck, or when the children aren't on the right track, or old parents need to be looked after, these are the 3 big areas where we have real worries and all lose new energy, and it is usually the relationship. The woman said, I would like to change my husband. You'd like to change your husband? And then she stood there next to the couch and I looked for her back pain. I say, what about your husband? A young, beautiful woman. Then she said, he's the love of my life. However, when we go out, he says in front of our friends, shut up, you have nothing to say. You have nothing interesting to say. I said, what? And that is the love of your life? What is that? And she says, yes, I don't know what to do either. And that has happened several times. And then he doesn't remember it either. Then I ask her what I always ask. What do you think of yourself? Then she says, very sadly, I think I'm a boring person. I have nothing important to say. And here we are on the subject of mirrors. It is red, the true love. That is what we think falls from the sky. It doesn't fall from the sky. We fall in love.
You mean we radiate this? I radiate exactly what I feel about myself, and the environment around me actually reads this unconsciously.
It's a lot easier. It is here, there. It is on your forehead. I'll give you an example from my younger son. I have 2 sons. Everyone will say their sons are wonderful. Mine anyway. I've heard you say you have 3 wonderful children.
Yeah, 4.
4 wonderful children. I did not want to offend you. So my son was 7 or 8 and he'd just started elementary school. And he came home completely hysterical. Someone had attacked him. on the way to school in broad daylight and wanted to take his school bag away. At that time, the topic about foreigners, that wasn't an issue at all. I also see it very differently today. And he was completely hysterical. When he was still crying, I went up to him and said, "Listen, how are you doing at school?" Then he says, "Oh, I think I'm not as good as the others. I'm not as strong as the others. I'm not as smart as the others." There it is. Children read so carefully, and that turns them into monsters at school sometimes, that we see as monsters. I learned stories at school where musical instruments are thrown across the yard, and where children under the age of 10 already understand how they form groups so that one is excluded. I have just accompanied a child with acupuncture. She kept coming back with a sore throat and repeated attacks of fever until I found out what was going on. New class, that's what happened. And the leader threatened everyone, just as the US threatens Cuba. If you talk to her, you're excluded. So that the children have turned away. And the bad thing about this bullying behaviour is that we, when we are excluded, then the emergency lights come on. Do you know why? To be excluded, not to belong, means that the primal feeling that we have in all of ourselves, you're excluded if the tribe, if the clan expelled you back then, you were dead. Nobody survived in the wild. And that's the terrible thing about being outcast. You could say here, "I don't need you," but it is not like that. And there we are right at those keys that everyone has on their shoulders. Press the excluded key and you are dead. Then you actually feel threatened with death. Incidentally, this also occurs in relationships, the threat of death. But to fall in love, you've already said, you also wanted to know how do you actually fall in love. And I'm a fan of Michael Loos-Muller. Sadly, God bless him, a professor in Frankfurt of medical psychology. He once said that two souls are sitting in front of each other. And they exchange, who are you, who am I, okay? Yeah, I see you've got your old childhood thing. We'll do that again, fine. And what can you do for me? Okay, something uncomfortable too. Apparently with the aim of maturing and learning. Except that there are no instructions. Did you get any instructions when you were 10 or 15? Were you told, "So, my dear Alexander, this is life. Here is now the time for you to be instructed in love"? Probably not. The souls exchange first. Harville Hendricks says that too. He's an American couples therapist. And then you feel like you're in love. And then comes the fascination. Why? Because the relationship should be a learning field in order to become mature, to become whole. C.G. Jung said that in a relationship you become whole, and then it often happens. Wherever I give lectures about it, I go in the front row and say, "And you, we'd be in love now, both of us." Do you know the feeling of it's like I've known you forever? As if I hadn't only met you yesterday, but as if we've known each other forever. You seem so familiar for me. Watch out if something like this happens. Be careful. This being familiar is because I recognise in the other the one who used to do something unpleasant to me. Maybe the father never listened. Perhaps the mother never accepted our opinion. Maybe someone always lied to us. Maybe someone was unreliable. I recognise that in the other because they will bring the subject to me. They'll bring it to me. For a long time I haven't understood what it means. Partnership is a way to wholeness. Partnership is a way to wholeness, to become whole. That is what Harville Hendricks, a famous couples therapist in the US, once said. Partnership is a way to wholeness. I haven't understood that for a long time. You're in a partnership, there's trouble. What is there to become whole? What do you want there? What should happen there? Today I got it. I'll give you an example.
Please.
Let that be a personal example. Personal examples mean I give you, the viewers, the trust, so to speak, that I can give you a personal example. I'm not just talking from the pedestal. My editor, who edited the book, said, "You have to tell more about yourself. You can't just be sitting on your high horse. You know it, the others don't." Yeah, sure. My second husband is a really cool man. Although he also has to endure hearing that the first husband was good too. But I got stuck with him. I didn't know some things. The first husband, who was also a doctor like me, still is, I sent the book to him when it was finished and wrote, "This is for you." If I had known then what I know today, we might not have been divorced. But if we weren't divorced, I wouldn't know today what I know today. That is the point.
Exactly.
And I know that with my current husband, that always the topic time played a role. I think he doesn't mind it if I say that his father often didn't pick him up from school, forgot him. The boy wasn't important enough to him. At 14, he stood like an idiot at school. There were no cell phones, father forgot him, he was not important to him. That is something that is imprinted on your forearm, and that's an experience that you will never forget. Time has a different meaning to me. I was always the first to be picked up from a party. I became restricted with time, so time has a completely different meaning for me. I take my time where I can. So here I know I have to go now, but I'm just doing this again and just doing that again. You don't want to know when I'll go to bed because you can also use time at night. Time is precious to me, and if you waste it, I start to bite. Two people, both on the same subject, but in a different way. And then this is what happened. I know that it's like this. We had a huge fight. We were in his house. His children played with me. I didn't have a watch. And we wanted to go into town to buy these rings. 6 o'clock, I came down. It was 6:10. I didn't have a watch. It was very quiet, and suddenly there is trouble. I can tell he's drawing a plan below. And he starts screaming angrily. Why didn't I come down? And so on. I say, because of 10 minutes. I say, what are you doing? Why is that so? Then he says spontaneously from inside himself, I wanted to know if it would happen again. I met my friend, the psychologist, in the evening and asked her. Then she says there he performed his old story again. 2 months later, I'm sitting outside working on a presentation, and we said we cook at 7. I work and I just can't think of a story that fits. And I try and work, and at 10 to 7 I got it. And I work, I sit, and I work and work there. And it's 5 to 7, 4 to 7, and it's 3 to 7, and I think, if I had 5 more minutes, I'd be done. You like to be finished when you go in and have free time, right? I thought to myself, no, you won't do that now. You close it now, and you go in now. I'm going in, it's 7 o'clock sharp. I have read in my husband's eyes that there has been healing. Healing means that someone comes who does it differently than before. And since then, my brief delay is no longer the subject for him. It no longer feels offensive.
It's important.
The point is the partner repeats what the parents have already done. And it reminds us of what is to be healed. And healing is possible, but for that I have to know first, what was this like before? I have to consider secondly when there is trouble. Yes, it has to do with me. It may be my subject. I should look at that. And if the partner protests angrily about something, I should see what is their reality right now. Where are they now? Are they 5 now? I often ask that, how old are you right now? When a patient lies there and cries, how old are you right now? Patient comes with tinnitus. Tinnitus is so difficult to treat. With all possible procedures, I can tell you with ear acupuncture, come back with back pain and you will go out after a session. And you no longer have back pain. I go deeper, I go in, there's an appendix scar, which disturbs the gall meridian. Well, we'll work on this. You don't have to have back pain for the next few years. Migraines, allergies, rashes, everything. Tinnitus is difficult. Until I understood tinnitus, someone comes with severe tinnitus, burnout. My colleagues often send the patients to me. I do this niche medicine. And then the patient lies there and is very anxious. The work is terrible. The work stresses them so much. And I say, what's the worst part about work? The worst. When someone has burnout, always ask what's the worst part of the job. And the patient says, The boss is the worst. And you see, relationship in private or relationship at work, the drama is either at work or in the personal life. What's the bad thing about the boss? Does he know a lot? Yes, he knows a lot. Is he competent? Yes. And is it actually a good boss in any other way? Yes. What's the bad thing then? And then he says, I am sick of it, that he never listens. His tinnitus, he is sick of it, that he never listens.
And now, what next? Now you found out. But he doesn't know yet.
It's really easy. There aren't many fields in which the problem can be. That's the magic. There aren't many fields. You don't have to dig esoterically in the red fog.
Well, you tell him specifically that he should talk to the boss.
No, nothing. I am also against, or almost against that, when bullying takes place. That you just look. How can you find the ones that trigger it? I asked him, who used to not listen? He knew right away, my father, and then this man lay there and cried. My father didn't listen.
That was on his forehead again.
It was inside him. On my forehead is the mirror. What do I think about myself? But he has this drama inside him. And there are famous couples therapists like Harville Hendricks who says, we search with greater precision than an American cruise missile. The partner who repeats the old drama with us. Magical, the soul's exchange. What do you have to bring on stage for me? This is called restaging for a reason. We're bringing it back on stage to look at, to heal it this time. And he doesn't just bring it to the stage. Because of that, he also brings it to the stage for another reason. It feels so familiar.
Oh, the familiarity.
It smells like that. Did you know that there are studies that show that women choose men who smell like their father? I just got interviewed on a radio. I don't want to say which one right now because the boss of this radio station said to me, yes, I can say that about my first husband. He always smelled so nice of tobacco until I couldn't take him anymore. Like her father, he smelled of tobacco. But that's not the only thing. We look for the partner who feels familiar. That's the sound of childhood. That's kind of a huge chapter. The mirror is what I think of myself.
Now, we're exactly in the premiere class, and that's exactly where I really want to hear 100 more examples that we really understand. But now, in this case, to finish it off, this person understood that it came from the father. The father never listened either. Now, he could somehow process that and let go. And it was deleted from here?
Well, this is more like a mirror. That's a different topic. He is everywhere in all his cells, which is why he is looking for and challenging this person so he behaves in this way. There is so much non-verbal communication. To recognise it alone often leads to catharsis. Catharsis means a solution. Catharsis is often, okay, it has to do with me. Then I often say, I can't get up now because the camera's of it, but take a step to the side, step aside. You're completely, if you're the boss now, and that man, I'm completely involved with you, and you're doing it again, and I go back to work and it happens again. And I put on a different shirt, it happens again anyway. I can't get out of there at all, so step on the side. Step on the side, look that you get a clear view. How was that before? Yes. That's right. It's like my father. And the point is, when he sees the boss, that it's like a filter between him and the boss, and he sees the old behaviour from the father. That is a point. And he was smart. He said, OK, I should take a look. This is my subject. That makes everything so much easier. I then advised him, if you go to work tomorrow, and that happens again, be careful then. Take a quick step aside and say to yourself, interesting, yes, this is like my father, instead of being against it. I got it from Harold Reinhardt's Psychosynthesis in Cologne. He says of opposing it, we should care. We should take a look at the topic instead of firing against it all the time. It's like trying to skip your own shadow. The first easing step is to consider it possible that anything that happens to you with your partner can be related to you. A dentist once said to me, came to my practice, she had a physical problem. She came and she said to me, like she did this. You know, I don't know you yet, but your book saved my marriage. I said, why is that? Then she said, yes, very simple. I've taken all our problems back to myself and have looked here in the chapters. This is not just the book, YouTube and so on. I've looked, where am I? What is my problem? And then I saw what my problem was, and we haven't had any problems since. That got me. I sat and thought to myself, do I cry now or do I cry later? And this man with tinnitus, he can get out of his tinnitus.
Did he make it?
He made it. Yes, and tinnitus is common when you are sick of something. Or what is it that you should be doing? Sometimes it is also very mundane. Tinnitus can develop when the cervical spine is blocked, which should never be overlooked. So before you just start working in this area, I always exclude the very physical things first. I look at everyone's spine. What about the cervical spine? The blood vessels are hanging in the individual vertebrae. You just need to be shifted, and then you may have tinnitus already. When we get older, thank God we get older too, it can happen that there is a bit of calcification in the ear. When it all comes together, you have it.
Dear Beate, now we're really in it, but I have to stop now. But we have to keep going immediately.
Let's do it.
And for you, dear viewers, that simply means tune in again next week. Because now it's getting really exciting. Now we're going into practice in this. I keep saying premier class. Where is the cause of real suffering? The body suffers at some point. We all know that in the form of diseases, inflammation or pain. However, if we really know what the cause is, and that it's written on our foreheads, and that we just really attract certain things, that's just incredibly exciting for me. So, stay tuned, dear Beate. Thank you for the first episode.
My pleasure.
And all the best to you. See you next time.